students, and now we are going to see with the respiratory pediatric conditions. The with the previous classes we had discussed with asthma and all those things with the pediatric disorders. Then now we are going to see from the cystic fibrosis. So this is one of the chronic multi-system disorder which will be usually caused by the autosomal recessive trait problem. So as characteristics with this condition, you will be getting affected with the exocrine gland will be getting more dysfunction. So along with this, some of the respiratory conditions under the GI system and the reproductive systems also will be getting affected here. Mainly the abnormal thick, tenacious, copious formation like mucus plug formations will be more in these organs, in these gland. So which will be causes obstruction because of this more production. So common symptoms this will be associated with the if it is been getting affected with the GI system, pancreatic enzyme deficiency happens and the pancreatic fibrosis will be more, which will be caused because of the duct blockages, and the progressive chronic lung diseases also will be there as a result of the infection, and sweat gland dysfunctions also will be more because of the sodium and the chloride will be increased in its production. That means increased in their sodium and chloride sweat concentration will be more because of this tenacious mucus plug formations even in the exocrine gland, mainly with the sweat gland. So to diagnose this condition, usually we will be doing this sweat chloride test. So in the test what we will be doing means we have to, usually they will have the sodium and chloride will be more in their sweat. So even in the saliva also. So we will be diagnosing the sweat chloride test with the presence of the sodium and chloride in the test. So with that presence we can able to diagnose this condition. So this is usually one of the progressive condition and incurable disease also, which can also causes a respiratory failure also here if it has been affecting the lungs and with the respiratory system. So that is one of the complications you can see here with the cystic fibrosis. So if it is affecting the respiratory system, what are all the characteristics you can see we are going to see now. So usually the symptoms will be produced by the stagnation of the mucus in the airways you can see, and because of that mucus plug formations the bacterial colonizations happens here. Even the destructions also will be more with the lung tissues, and emphysema and even atelectasis also occurs here as the airways becomes increasingly obstructed, and chronic hypoxemia also will be causes a contraction, and hypertrophy also happens here with the muscle fibers in the pulmonary arteries and the arterioles, which will be leading to the pulmonary hypertension at one point. Eventually carpulmonale also is another one problem which can be seen here as a complications if it has been affecting the respiratory system. Pneumothorax also from the ruptured bull and with the hemoptysis from the erosion of the bronchial wall will be usually occurs as the disease has been progressing. You will be having all those complications, and wheezing and cough, dyspnea, cyanosis, clubbing of finger, toes, and with the barrel chest, and repeated episodes of even with the bronchitis also will be arises here. Even it can lead them to the pneumonia. So like this way the different complications happens here with the respiratory system if it's been getting affected, if it has been getting complicated here. So then when we go with the GI system, the cystic fibrosis, usually the meconium ileus in the newborn will be the earliest manifestation you can see here, and the intestinal obstructions also will be there, and the distal intestinal obstructive syndrome, which will be usually caused by the thick intestinal secretions over that part. So as a sign they will be showing the pain over that part, and abdominal distension and nausea and vomiting will be there. So with their stool formations also will be like looking like frothy and foul smelling, because the pancreatic system also will be getting affected here along with this. So the deficiency of the fat soluble vitamins will be there, like A, D, E and K deficiency will be more, and which can also result in the easy bruising and with the bleeding and with the anemia, malnutrition also, and with the FTT values also will be like when you take concerns you can take a dose test to analyze those conditions, and the demonstration of the hypoalbuminemia also can occur from the diminished absorptions of the protein and that resulting in a generalized edema. And rectal prolapse also will be resulting here because of the large and bulky stool formations. Even because of the increased in intra-abdominal pressures, they will be having those rectal prolapse problem also comes along with this condition. And pancreatic fibrosis also mainly occurs here because of the GI system. Very importantly, the pancreatic system, their pathways will be getting obstructed because of this mucus secretions and the thick secretions. Even in the liver systems also they will be getting affected. So as if the patient is already having any diabetes, not with already, the patient will be getting into the risk of getting diabetes. because of this pancreatic fibrosis problem. So this is the usual things happens here if the GI system, if the GI system got affected here with the cystic fibrosis, the person will getting into this type of problem. Next is the cystic fibrosis. If in this cases, if they are getting affected with the integumentary system, we are going to see what are all the changes happens here. Abnormally, there will be a high concentration of sodium and chloride you can see in their sweat, that usually noted here. So when you see the parents, they will be reporting that whenever they kiss their infant, whenever they kiss their child, they will be feeling like a salty taste in their mouth. So like in their lips, they will be feeling. So even the child will have the dehydration, and the electrolyte imbalances also occurs here, especially during the hyperthermic condition. So next to the reproductive system, in this cystic fibrosis, even the reproductive system is also got affected. So usually the puberty will not be attained at a particular age of time period with the pre-adolescent age group. That is the time where the puberty usually happens. So that will not be in a proper time for those children. So they will be getting delayed in their puberty, mainly with the females. And fertility also will be getting affected here, because the cervical mucus plug formation and secretions will be more in this condition. So those women, even after they are getting puberty and after their marriages, so they will be like fertility also will be like, it will be delayed. So even that can be plug formations and those mucus will be blocking the sperm entry. So that will not be, they will not be able to be like fertile. So next to the males, they will be usually like sterile as a result of blockages with the vas differences also, by the abnormal secretions and the failure of the normal development of the duct structures. So how to diagnose this condition means, usually these are all the tests which has been done here. Quantitative sweat chloride test, that usually gives the positive result for you. And the newborn screening also may be consisting of immunoreactive trypsinogen analysis, which will be giving the result. And direct DNA analysis for the mutant genes also will be showing the result. So as a newborn screening, that will be consisting of immunoreactive trypsinogen analysis, and direct DNA analysis will be done with their mutant gene, because this is one of the autosomal recessive disorder. So we have to analyze this one also, so to confirm this condition. And chest X-ray is also done here. So because they will be getting with the respiratory system, if they are getting affected, atelectasis, obstructive emphysema will occur. So we have to diagnose all those things. And pulmonary function test is also done here, which will be providing an evidence of abnormal small airway functions. And stool test and fat enzyme analyzations, these are also will be done here if the GI system, if it is been getting affected. So the 72-hour stool sampling will be done here for these analyzations, so that we can check the fat presence and with the enzymes presence also, that is a trypsin, and the content and with the both things we can analyze here. So when you go with the interventions, with each and every system wise, we have to do the interventions. Like cystic fibrosis, in this cases with the respiratory, if it gets affected, so the main goal of treatment, we have to prevent and we need to treat the pulmonary infection initially, and we need to improve the aeration well, and we need to remove, mainly with the secretions, we have to remove those mucus plug secretions from all the systems, even in the respiratory also, because this will be obstruct, this can cause us more distress in the air, with the air respiration. So we have to remove those secretions and administer the antibiotics mainly, because to prevent the bacterial growth because of those more mucus plug formations. And monitor the respiratory status also, and the lung sounds we need to hear, and cough also. And chest physiotherapy is also been done, like percussion and with the postural drainages is also done on awakening time, and even in the evening time also, every day, to maintain the pulmonary hygiene. This is not done before or immediately after the meals. That is also we have to see for. So when we have to do and when we should not do, so those things we have to follow with the physiotherapy. And flutter mucus clearance devices is also given here. That is looking like a small handheld plastic pipe like thing with a stainless steel ball you can see on the inside, which will be facilitating the removal of the mucus, and that may be prescribed here and store away from the small children's, because that will be containing a small ball like steel ball you can see. So which can, if the children are been handling it, they can have the choking hazard. So you should not give this for the children, and even that means this is usually used for the therapy purposes, but yeah, other than with the therapy purposes, you should not leave it as reachable by the children. So you should always keep it away. And handheld percussions and special waist devices is also given here to help in loosening the secretions And positive expiratory pressure mask is also be prescribed here. Use of this mask will be forces the secretions to the upper airway for the expectoration. And the child also to be taught the forced expiratory technique like huffing to mobilize the secretions for the expectoration, and bronchodilators like open that will be more helpful in opening the bronchi. There is a more secretions is there. For easy expectorations, this will be more helpful for us, and to administer before the chest physiotherapy, so that way we can bring out the secretions out easily and we can able to clear out the airway. Even in the cases of wheezing also we can provide this. And medications that which has been causing a decrease in viscosity of the mucus also will be like prescribed here. And physical physiotherapy programs mainly will be aiming at stimulating the mucus expectoration and to establish the effective breathing that is being used here. And IV antibiotics is also used here. Oxygen therapy also during the acute episodes we have to use, and monitor them very closely for the oxygen narcosis and the nausea, vomiting, malaise, fatigue, numbness and tingling of extremities, and substernal distresses is also. So we have to check for all those things with the oxygen narcosis cases, and if it is like any narcosis happens with oxygen. And because the child with the cystic fibrosis may have a chronic carbon dioxide retention also, so that is also happens here. So we have to check for all those things. As like a COPD conditions here also, the carbon dioxide retentions will be more, so you have to check for that. And with the lung transplantation also will be needed at one point, because if this has been more affecting them, their respiratory system, we have to go with the transplantation with the lungs also. So the next interventions with the GI system. So if the cystic fibrosis happens here with the GI system, like a high calorie diet, high protein diet, well balanced diet for the energy and growth needs will be needed, and multivitamins especially A, D, E and K will be getting deficiency. So we have to provide that fat soluble vitamins, and we need to monitor their weight and monitor their stool patterns also. And for the signs and symptoms of the intestinal obstructions also we have to check for. And the main goal of treatment here, what is that means, the pancreatic insufficiency usually happens here. So we have to replace the pancreatic enzyme. We as a tablet format that has been usually available. So we can provide those pancreatic enzyme. So those drugs can be administered here. So those administration should be done within 30 minutes of eating and administered with all meals or with the snacks we can provide. Mainly with the fat containing products we have, with the fat containing food items we have to administer. An entry coated pancreatic enzyme is also been available. So those drugs should not be crushed here. That should that should not be chewed also. And capsules will be like sprinkled on a small amount of food. You can sprinkle and you can administer for the children. And we have to monitor them for the constipation problem and rectal prolapse, intestinal obstructions also in this GI system if it gets affected. And GERD also can happen here. Gastroesophageal reflux diseases also can happen. So we have to monitor for all these things when the GI system is being got problematic with the cystic fibrosis. As additional interventions, we need to monitor their blood glucose level and with the diabetes mellitus, and we have to ensure adequate salt intake also, that will be providing an adequate supply of electrolytes during extremely hot weather. And when the child has a fever, we have to check for all those things, whether they are getting an adequate salt intake or not, whether they are having adequate salt presence in the serum sodium level, we have to check. And monitor their growth with the bone growth also, and we need to monitor them for the signs and symptoms related with the retinopathy and with the neuropathy, because that is also happens here. So as a complications of these, all along with these conditions, these are also another one problem that usually comes along with as an additional problem comes here in their body. So we have to check for those things, and emotional support is also needed here, very especially for their parents. So then as a home care, finally, home care will be involving like educating the parents and with the child. If the child is like somewhat like a very young child, even though like 4 or 5 years or 6 years, according to their age group, we have to educate them, and we have to give them a proper support about all aspects of care for the disorder. And we need to inform the parents and child also about the signs of complications and action that is being taken, and the importance of follow-up care is also like it's been like critical. So we have to educate all those things, what are all the plan of care that will be going on. And next we need to instruct the parents also to be sure that the child will be receiving the recommended immunizations on schedule. And additionally, the child should be like immunized also against the influenza by the age of 6 months itself. We have to because from the initial days after their birth, from the time of birth, and for each and every month they will be having a particular schedule of immunizations they will be needed to be taken. Even the yearly booster also will be needed. So with appropriate immunizations should be completed each and every time of the year, month, and with their age they are going on. With along with these conditions they have to take it. So only then we can able to prevent the additional conditions along with the cystic fibrosis. We can able to prevent those conditions and inform the child and parents also to get combined with the CFFF foundation is there. That is a cystic fibrosis foundation is also there. So we have to orient them with that foundation, and so that way they can get updated with the informations and the treatment and the management and with the support systems. All those things will be they'll be getting appropriately at a particular